I'd like to welcome the Minister, and I appreciate that he's got a particularly good grasp of the answers I've been listening to today. And I just want to concentrate, you would have heard me on these issues before, because most of people who have died or been seriously ill as a result of the coronavirus are actually older people or people with immune systems which are suppressed or impacted on. Are you satisfied, and what additional steps are you taking to ensure that nursing homes, be they public or private, are ready for the winter, and obviously particularly for influenza and COVID should it unfortunately come?
Thank you very much, Deputy. I think that's one of the most important questions any of us can ask right now, and I want to acknowledge that in my time on the COVID committee that you have been a tireless advocate on exactly this question and making sure these measures are in place. Yes is the short answer. So we have a very useful report from HIQA. It looked at the half of nursing homes that didn't have COVID outbreaks and assessed them across a wide variety of measures in terms of their preparedness for a second wave. I have written to HIQA and asked them to do the same for the other half, obviously. We had a very, very comprehensive report from the expert nursing home group. They have 86 recommendations across 15 themes. We launched it last week. We have set up an implementation team, including the stakeholders that need to be involved. They also have expert advice from people who were involved in writing the original report. They will be coming back to me very soon in terms of the additional measures that need to be put in place. My goal and government's goal is to make sure that everything that can be done is done for all nursing homes. I have to say, I believe the nursing home recommendations were superb. There were some very short-term ones. In fact, some of them we already have in place. There were medium-term ones. They also took a look at the much broader questions around is regulation of older care in this country good enough? It's a point you've raised repeatedly yourself. The answer, of course, is no, it's not. So they have also given us direction in terms of the work that we have to do in this government to improve elder care, be it in nursing homes or in hospitals or of course at home. And we've seen some very striking figures for other countries, particularly in Scandinavia, in terms of the percentage of people who can live in their older years at home as opposed to going into nursing homes if they have the supports at home, which they should have, and which we want to take a very close look at making sure happens.
I welcome your comments on that, and I would hope that with your department and with the Oireachtas administration we would have a full debate on them perhaps next week or when we come back. Just to take you up on that point, it's a commitment in the programme for government that there will be a statutory home care package introduced as quickly as possible. And can you tell me what progress has been made on that? I think I have spoken to a number of people who have either in nursing homes or the families have family members in nursing homes. A lot of them would love to live at home if they could, but in fact in the past, notwithstanding the increase in hours which you spoke about, the facilities haven't been there for them. So I know as we move into winter there will be an increasing demand for home care hours. So are you satisfied that across all of the CHO areas that there will be adequate home care, both in terms of the hours available and the qualified persons to provide that to those people?
Thank you, Deputy. So, as part of the COVID measures that have already been taken, 2.6 million home care hours, additional home care hours were allocated, and that's to do exactly as you said. It's to say we've got to do everything we can to keep patients, particularly those more vulnerable to COVID-19, out of the hospitals. As you say, one of the most important ways of doing that is to provide adequate home care hours. So 2.6 million additional home care hours have already been deployed and sanctioned. The winter plan will be looking at a very considerable additional number and bulking up the multidisciplinary teams required to support people living at home. We have to do everything we can, Deputy, this winter to make it unnecessary for people people to go into hospital. So what are we doing? We're providing as much home care as possible. We're also looking at putting in place community hubs so that people with respiratory issues, maybe people who get the flu, can be treated as they need to be treated, but not in the acute setting this winter. To your direct question on the Fair Deal scheme, it's something I absolutely want to see. I think the current situation doesn't make sense, whereby if you're well enough to stay in your home, the state won't provide the supports required. But if you go into a nursing home, the supports will be provided. I think that's backwards healthcare.
Very much.
And I want to work very closely with the Oireachtas and with government to do something about that as quickly as possible.
I tell you what, I'll raise that with you in the Oireachtas by PQ or whatever, but I welcome your comments. Now, the two issues that upset me most and upset most of my constituents, and indeed the whole country, one of them was this morning when we had a wife of a poor man and his son who died in Kilbrew nursing home, and the appalling description of, you know, the maggots on the poor man's face and the way he was being treated cries out for justice. And while I understand you're talking about other inquiries, I think you need to appoint urgently a qualified professional who will look at Kilbrew House, and I know there were other deaths there as well, as a matter of extreme urgency, a qualified person. I know that Des O'Neill did the one on Lee's Cross some years ago, but I think it needs to be done. It is absolutely unacceptable what I understand happened there. And I think part of the inquiry has to be into the correspondence between SAGE, who are representing this family, and HICWA. And I think there are 3, if not 4, notices of concern issued to them directly about this family. And it's just appalling. And the second part of the question, and I asked it this morning of the HSE, the deaths in Dalgan House were the highest of all the deaths in County Louth for a period of 3 months. I think half of them came from Dalgan House, and families are extremely upset. There was a report done by HICWA, but they haven't seen sight of it, and they're not getting answers from the HSE and indeed from the Department of Health. Their view is that there's obfuscation and delays. They've spent hundreds of euros on FOIs to try and get at the truth as to why the Department of Health and HICWA put in the Royal College of Surgeons in there, into that nursing home to run it because of what they found. Now, they've lost their families members. They're in absolute trauma at their deaths. They are absolutely deeply frustrated at the bureaucracy they're meeting. So can I ask you the same question as I asked Mr. Reid this morning? Will you meet with those families, number one, to listen to their issues? And will you appoint a competent and qualified person, especially and specifically, to look at what happened in that home on the particular and special grounds that you put in? I mean, you, the Department of Health and HSE, put in a special team to manage it, because one of the issues that the majority of staff who worked there were unable to be on duty, and patients, you know, they died. And there is evidence that the HSE was aware of the fact that, say, that a very significant number of workers were absent due to illness and other reasons, and that while they gave assurances that were acting, there was a delay of at least 4 or 5 days, where a lot of people would have caught that COVID as a result. So this is a very serious issue. I'd appreciate your comments on it, please.
Chair, I know I'm out of time, but given the sensitivity, can I take a short bit of time to answer the questions for the Deputy?
Of course, yeah.
Thank you. Yeah. Deputy,
I'll agree.
Thank you. Deputy, I share your sentiment in terms of what has happened. And can I start by saying, I, along with us all, I want to express my sincere condolences to Mary Bartley Meehan and to her family, to Mr. Meehan's family, during what must be an extremely difficult time. HICWA is investigating what happened, and they are providing a report to me.
That's my whole point.
Can I just say, Deputy, to answer your question, if I believe that the HICWA report does not sufficiently answer the questions that the family have a right to know, then I will act.
I think, Minister, if I can intervene here, HIC were the regulator. They didn't regulate and they did not act, and they cannot be the decision maker in this. That's why I think you need, and I appreciate we've short time, an independent inquiry. I can send evidence to you that may help you make up your mind on that.
Thank you, Deputy, and please feel free to do that. Deputy, what I'm saying is this, is that in the first instance, the only agency of the state that can do this is HICWA. That's the current law. That's the current regulatory environment.
You're the regulator of the Home Minister. They didn't do their job.
No, that's fine, Deputy, but what I'm saying is in the first instance, HICWA have to investigate. And I'm not, and I'm sure you'll appreciate, I'm not going to be making allegations about the inability of HICWA to investigate. They are the state regulator. They're very good at what they do. If I conclude...
You're not going to have a conversation over and back. We do need to bring it.
Yeah, sorry. I'll just finish on this, Chair. If I conclude that in either case, Kilbrew or Gelgan House, that the very reasonable and real questions of the families have not been answered, then we will take further steps.
Thank you very much, Minister. Thank you, Deputy O'Dowd.